Good afternoon, and thank you for joining us for the Outdoor Art Club presentation, COVID-19 in Marin. I'm Robin Geisler, and I'm working with my fellow OAC team members, Kate McCormick and Jane Stewart, to bring you this program. As you know, we are using the Zoom platform today. We've found that Zoom is not always perfect, and neither are we. So although we've worked hard to master all of Zoom's little idiosyncrasies, things still don't always work out quite the way that we thought that they would. Please be patient with us. For those of you who are not familiar with the Outdoor Art Club, we're a nonprofit women's foundation founded in 1902. The club engages in civic, cultural, and charitable work in our community, including presenting public programs like this one in our annual speaker series. Before I turn this program over to today's program chair, please note that Zoom has two different functions for chat and Q&A. You should use chat to connect with our technical help. Jane Stewart is providing the tech help today. Or if you'd rather, you can just call Jane directly, and her phone number was included in the event reminder emails you received, one just an hour ago. Please use Q&A to send your questions to Dr. Matt Willis anytime during this program. Dr. Willis will leave time to address your questions at the end of his presentation, although he may not get to all of them. Our presentation will probably still end around 2 o'clock, if that's okay. At this time, I'd like to introduce Allison Lang, and Allison is a member of the Outdoor Art Club and program chair for today's event. Thank you, Allison, for bringing us today's program.
Thank you, Robin, and welcome everyone. Dr. Matt Willis, a Marin native, has been the county's public health officer since 2013. Dr. Willis calls on his experience as a physician, an epidemiologist, and a member of the community to guide public health strategy in Marin. He has served in the U.S. Public Health Service as Director of Primary Care on the Navajo Reservation and at the Center for Disease Control in Atlanta, where he conducted research and outbreak investigations in the U.S. and abroad. Dr. Willis has published research in tuberculosis control, disaster response, and opioid safety. He holds a medical degree from Temple University, and he completed a master's in public health and his internal medicine residency at Harvard. Matt lives in San Anselmo with his wife and 3 children. Now here's Dr. Willis. Matt?
Okay, thank you. Hi, everyone. Matt Willis, Public Health Officer. I'm just going to spend a few minutes going through kind of a state of the county with regards to our COVID-19 pandemic experience and response. Talk about that a little bit in the context of what's happening across the state, the nation, and the world. And then talk a little bit about some of the emerging tools, the vaccine that's on its way, and then some of the concerns around the upcoming holidays, and then have a chance to answer your questions. So I'm going to start by sharing some slides. And I guess you'll be submitting questions along the way if questions come up, and then we'll have a chance to address them all at once rather than do them along the way, if that's okay. So if you have questions as I'm sharing this information, just go ahead and type them into the Q&A, and we'll get to them at the end if we can. Can you hear me? And I just want to make sure that you can hear me and that you can see my slides before I keep going.
I can hear you and I can see your slides, so
Perfect.
I'm assuming.
Okay, so this is as of Monday, and it just shows the total number of cases we've had in Marin, just over 5,000 cases with 100 total deaths, which is a mortality rate in Marin of about 2%. Of those 100 deaths, 84 occurred in residents of long-term care facilities, either skilled nursing facilities, nursing homes, or long-term care facilities for the elderly. And that hospitalization rate versus death rate, some have asked, does that mean that more than half of the people who end up in the hospital end up passing away? As I said, because many of the deaths, the majority are among people, residents of long-term care facilities, they are often not transferred to the hospital for care, because that's according to the wishes of the family or that individual who had been identified. This is our rates of our hospitalizations and intensive care visits. So you can see there from the month of, I'm going to be sharing data with you. I think that I should preface that. This is how I navigate our decision making. We want to be science-based and data-driven. And so I'm constantly looking at what I see as sort of the vital signs of our response. The way your doctor might be looking at your blood pressure and your pulse and temperature and those sorts of things to sort of adjust how he or she cares for you. That's how I look at our epidemiology. I look at the data, the statistics coming out of our community to see how I need to adjust, how we need to adjust our strategies to stay on top of this. And I think that we can look at that's a lot of that same data together so that we understand what we're experiencing together. So for those who are a lot less interested in data, I will apologize in advance, because that's a lot of what I'm going to be offering you is our numbers. But hopefully I can make it understandable. This is so we had an increase in our hospitalizations there on the far right, that blue line. You can see there was a jump from about 5 people in the hospital to 13 in the hospital earlier in November. It corresponded to the surge in cases we've been seeing. That's now come back down again, with 9 in the hospital and 3 in the intensive care unit now. This is something I'm going to be watching very carefully over the next few weeks, because one of our primary concerns, obviously, when we see surges in cases, is that there'll be surges in people coming into the hospital who are ill enough to require care there, which causes a surge in that setting. And when we talk about what happened in parts of the Southeast and in New York City, the hospitals were not able to manage the rate of new cases coming in with COVID-19. So we every day we are in constant conversation with our hospitals, and we get the numbers of patients, total patients in the hospital, and then the total patients who have COVID-19 each day. This is the epi curve. When we talk about flattening the curve, this is that curve. It shows the number of new cases per day in the county. And what it shows is that we had this, significant surge in cases over July that was experienced across the state, with a relatively steady decline in cases all the way until just there you see another blip in the recent past on the far right there. Starting in November, we've started seeing more cases per day. But importantly, by context, this is that same thing, that same curve, number of new cases per day, but for the state of California. And what you see is that same spike, that same surge in July with the decrease. But then there's been a really rapid acceleration in cases across the state in early November. And this is just a way to visualize those two curves together. On the top, you see the state with the first peak, and then they're very clearly established a second peak. And in Marin, on the lower, you see that first surge in July without as much of a clear signal of a surge in Marin yet for November. And then stepping even further back, you see what's happening across the nation. That July surge was much smaller by comparison to what's being experienced now, really starting in late October, and each day being rapidly accelerating. And that's obviously a topic of national and global concern. This is the same information but by state, and it shows that there are some hotspots across the United States, especially the upper Midwest. Importantly, despite the fact that we're seeing surges in California, they're on the bottom with the color coding. You can see that California is in one of the lowest incidence tiers compared to other states, and that there are states that have more than 10 times the rates that we're experiencing here in California. And what's important about that is that it means that the normal process of national redistribution of resources is not really available to us in California. When we saw surges in July, we were able to mobilize like the National Guard and other resources into California to help hospitals that were experiencing, they were overwhelmed through a national, under the CDC, reallocation system. That is not able to occur now because every part of the nation is now experiencing increased cases, and most areas are experiencing much more severe surges than we are. And then stepping even further back, this is the global picture. This is a pandemic, by definition, it's across the globe. And we're seeing in the Northern Hemisphere, especially hotspots in European countries. It's what we're experiencing in the United States is also being experienced in most European countries, with corresponding more restrictive shelter-in-place policies being reimposed in most countries across Europe. Now back to the state. So this was the governor's announcement on Monday, and what it showed is that the rate of increase in cases in this early November surge exceeds the rate of increase for that July surge. We're seeing, 50%, over 50% increase in 1 week, in that first week in November. And what's concerning about that, from an epidemiologic standpoint, is that the slope of that curve often predicts the eventual height. So the faster it starts, the higher it goes eventually, and that means more cases. So unfortunately, we would predict that based on how fast, the velocity of how fast this surge has begun, that we might see a surge that is much larger in its interval and height, total number of cases, than the surge that we saw in July. And that's why you're seeing such aggressive action being taken across the region and the state now to try and reduce the slope of that curve. And this is looking at the state again on the left there. This was the picture last week when we were, a state that had mostly lower incidence counties, mostly red, orange, or yellow, with a few purple counties. Again, maybe if you're not aware, I'll just remind you that the state has organized its response for the COVID-19 pandemic into what's called the Blueprint for a Safer Economy. Every county is categorized into one of 4 tiers according to the case rates. Purple being the highest incidence, most severe, that's tier 1, down to yellow being the lowest incidence, that's tier 4. And we are in Marin, we have moved from tier 3 orange into tier 2 red. But the rest of the state, looking at the right there, is almost all counties are in that first most restrictive tier. 95% of the residents of the state of California right now live in a county that is purple, because all the most populous counties, San Diego, Los Angeles, Orange County, and then a lot of the Bay Area counties are also in purple. So we are fortunate to be among that increasingly small fraction of counties that are not in purple. I want to share with you, this is analysis I just did to look at case rates in Marin compared to other counties. And what it shows there on the far right is basically the take home is that Marin is doing a lot better than all of the other counties in the Bay Area in terms of our case rates. And if you look at the far left, that's the beginning of September. Most of the Bay Area counties were traveling together more or less. We had, our case rates were similar within a narrow range, and the state of California average was in that range. That's that black dotted line. One little outlier was Sonoma County to our north that had higher cases, but aside from that, we were all more or less traveling together. That changed in late October, where it really started to diverge. And it was really mainly diverging in that other counties started seeing much more rapid increases in cases and at different rates than the rest of us. And Marin, that thicker blue line, you can see that our case rates have not changed very much. We have seen an increase. We made a lot of progress. In the end of October, we had some of the lowest rates. We were down to less than 4 cases per 100,000 residents per day. And have doubled that, which is concerning. We were in the 3s actually, but it's not nearly at the same rate as other counties around us. And this is our daily case rate. I'm almost done with the data. This feels very data-y as I get this far into the presentation. But these are our case rates right now. we're at about 4.3 cases per 100,000 residents per day, which puts us in the red tier. So we moved from the orange tier into the red tier, and we are probably going to stay in that red tier for at least another week. I think this is an important point for this group to understand also, which is that the epidemic has shifted its pattern in Marin County. You may recall that, you know, for the first few months of this epidemic, it's really been this disproportional impact on communities of color, especially our Latinx community, has been one of the main stories for Marin County. We had at one point 80% of all of our cases were our essential workers, you know, Latinx residents, and then their household members. And that has shifted now over the past month. The majority of our cases are among our white residents, much lower incidence in our Latinx community. We've made a lot of progress there. But what's concerning about this new trend is that it's happening all across the county. If you can imagine that first phase of the epidemic, when it was really primarily focusing on the Latinx community, it was also geographically focused in those communities that are more densely populated, Spanish-speaking communities, where people are serving as, you know, as our labor force, essential labor force. Now it's really every city and town is experiencing cases. So when we look at the map of, you know, every day I have a map where I have a dot where the new cases are emerging, and that map has really changed dramatically over the past like 3 weeks, where it was really such clustering in certain areas, and now it's much more diffuse across the county. And that's part of a dynamic where it's now mostly indoor dining. No, it's not just mostly, I'm sorry, it's indoor gatherings, including indoor dining, but, you know, parties, other gatherings, get-togethers, where people are indoors, maybe not facially covering, and that's driving this second wave of our pandemic. This is our schools. So we're opening schools in Marin. We have one of the highest rates of school reopenings of any county in the state. 82 schools are now open to some form of classroom-based learning. 71% of all of our schools. We've had a total of 15 cases in students and 1 case among staff. Importantly, none of those cases have been attributable to transmission that occurred within the school. So we haven't had one student affects another student in the school, or staff or students. It's been cases that were students acquired the infection in their household and then were at school. So we've had to close cohorts for that reason. But importantly, again, we're not seeing a lot of transmission within the school setting. And we have now about 300,000 student days accumulated since September 8th, when schools started reopening. So these are some of the new restrictions. Now I'm done with our numbers, getting into some of the text, then we'll have some questions and answers. The retail establishments and indoors are now at 50% capacity. We have closed restaurants, indoor restaurants in Marin County. Places of worship are open only at 25 indoor capacity, 25%. Same with movie theaters. We are banning concessions in movie theaters as well. Gyms and fitness centers are now open at only 10% capacity. They had been at 25% capacity. Libraries are at 50% capacity, and non-essential offices have been closed. And these are changes that have been made in the last week based on moving from the orange tier into the red tier. The reason that, in addition to those red tier restrictions, we made a decision locally to also close indoor dining entirely. And that would have been allowable at 25% in the red tier. And that's because we're recognizing more and more of the unique risk of that environment. So indoor dining is a concern because it's people gathered for an hour and a half, up to 2 hours across households in an indoor setting where facial covering is not possible. People are dining, they're eating, they're drinking. And, you know, if we think about our other recommendations to avoid social gatherings indoors, to only gather outdoors with physical distancing, facial covering with your group of 3 households, it's contradictory to then say, but you can also go into a setting, you know, that's indoors with people you don't know across multiple households and not wear facial covering and be there for more than an hour, and somehow that's different, the virus doesn't really care in that way. And so we wanted, and there's more and more evidence that those are settings in which transmission can occur. Our food service workers are among our highest percent positivity. When we do a testing, we get the occupation of the person who's being tested, where they work. And what we're finding is that the highest proportion of our positive cases, the highest risk occupation, if you will, is among our food service workers. And there have been what we call super spreader events in restaurants where, it's any indoor setting, but it's more frequently in restaurants because that's a more frequently engaged in activity indoors, where someone might have been infectious and over the course of an hour and a half meal might infect between 15 to 30 other people. And some of these epidemiologic descriptions across the nation of outbreaks that occurred that are traceable to just a single person in an indoor restaurant and everyone else who was in that setting, especially if the ventilation is not adequate in that setting. So that was the rationale for that particular decision around indoor dining. Then holiday gatherings, obviously stepping back, I think that what is most concerning to me about what we're seeing now is that it's preceding this surge that we're seeing across the region and the state and the nation is preceding what we were already concerned about. What we knew the threats to be, right? We knew the threats were going to be the holiday gatherings like Thanksgiving and the winter holidays, students traveling home, colder weather bringing people indoors, influenza. All of these threats are just starting. We haven't had Thanksgiving. We haven't had any cases of flu yet. The weather just started getting colder, and we're already seeing surges. So if the virus is telling us that those are that's what's contributing to this surge, which is as things move indoors, as the weather gets worse and more gatherings, if Halloween and maybe the elections with some more gatherings and then slightly colder weather is what's driving this surge already. Imagine what will occur when those things really start. When the weather gets much colder, we start getting rain. People are really more compelled to be indoors when they're together. Thanksgiving, the winter holidays, travel. We could be in much worse shape come December, and I'm concerned about our hospital capacity, frankly, if we get to that point. So that's why it's so important for us to adhere to these guidelines. As tired as everyone is in making, in terms of making sacrifices, now is not the time to let off. So we've offered guidance for gatherings outdoors, keep gathering outdoors, keep them small. The rules are that 3 households that are a stable group of 3 households that have agreed to be together, this is your bubble, can gather together outdoors in a physically distanced way. As I said in the restaurant example, shorter intervals are safer than longer. The longer you're together in a place, the higher the likelihood that you might be infected. And then stable. So similar to that notion of the cohort of people that you travel with, your holiday pod, picking the group of people that you would work with or be with socially, rather than going from one social group to another social group to another group. Many of you will have the benefit of having multiple invitations, perhaps, to different types of gatherings. And it's less safe, obviously, to be with one group on a Tuesday and another on a Wednesday and another at the weekend. Picking one group is the safest method. So, and then obviously the safest, of course, is to celebrate virtually and be together virtually as we are right now. And then we also offered a travel advisory in Marin, recommendation that people quarantine for 14 days if they're coming from outside of the area. The state followed that advisory a few days later for the state. In fact, that's now a tri-state advisory with California, Oregon, and Washington, recommending quarantine for 14 days for anyone who's traveling into the area, whether or not you've started in the area and left and came back, or whether you're just traveling into the area. A recommendation of a 14-day quarantine is not an order. It is not something that will be tracked and enforced through airline manifestos and that kind of thing, which we sometimes do, like with Ebola, we did that, really making sure and daily checks to make sure that people weren't out and about. It's not that kind of order, but it's a strong recommendation that people adhere to that based on their own understanding of risk. And the implicit message and the strongest, I guess, most important message is to avoid that travel in the first place, so that people are really, again, celebrating virtually rather than in person. There's testing for anyone that just, I know there'll be some questions on testing. The place to go for testing resources, I have some of them listed here, but the best place if anyone is seeking testing and doesn't know where to go, first is to contact your medical provider, and then you can go to our website at coronavirus.marinhhs.org/testing, or just navigate to the testing page, but it's coronavirus.marinhhs.org. And there's a variety of testing options available there. But the first, again, would be to start with your medical provider. I'll quick end with a vaccine update, and then we can get to some questions. So Pfizer and Moderna are the two manufacturers that seem to be sort of the two horses that are going to cross the line first in this vaccine race. These are mRNA vaccines, which is a new method for delivering vaccines and it basically uses the cell's ability to make proteins through mRNA for the cell to manufacture, your own body's cells to manufacture proteins that your immune system sees as the virus and builds antibodies against those proteins. So it's a brilliant method, and it works. It's looking like it's 90 to 95% effective. There are phase 3 trials that are now just ending. That's the last stage of the FDA process for certifying the safety and efficacy of a drug or a vaccine. And that's where you're actually testing it in people in real life. And each has 40,000 patients in both of those trials, so a total of 80,000 people. Half receive the placebo, half receive the vaccine, and then you just watch what happens. They're all just going about their regular lives. They're getting a shot. It just so happens that some of them are getting that shot are not getting the vaccine. They're getting a mimic, and no one knows. The study participants, or even the people who are giving the vaccine, don't know which group you're in order to prevent any form of bias. And at the end of the study, they unmask the results and they say, okay, you were getting a vaccine, you were getting a placebo, and they compare the infection rates in those two groups. And it turns out that among the 90 or so people who got infected in both of those studies, almost all of them were among people who did not receive the vaccine, who were getting the placebo. And for that subgroup, that half that were getting the vaccine, there were very few infections, and that's how you measure efficacy. So you could say, well, that's attributable. You can actually make a causal statement to say it is very likely statistically that the reason that those people who were in the vaccine group were not getting infected is because they were vaccinated, because we have a comparable group of people that did not receive the vaccine but had every other thing the same, and 90 of those people got infected. So it's a 95% effective vaccine, and we're looking at maybe getting that one or two of those products into Marin County, along with every other county in the state, in late December or early January seems to be the most recent time. And I'll end with this. Don't forget to get your flu shot. It's not too late. This is the time of year. Normally, we start seeing flu every year in Marin. The beginning of December is when the first cases really start creeping up. It's highly reliable as a seasonal virus. Every year we see spikes in cases kind of through December. And so this is a really great time to get your vaccine. It takes about 2 weeks to develop kind of the full immune response. So if you haven't gotten your vaccine yet, do it this week. So in summary, there's a surge underway. Our rates are rising, but most slowly than most. There are widespread restrictions across the state. We're in tier 2. Indoor gatherings are driving cases. Holiday gatherings and travel are not safe. Some really promising vaccine news, and please get your flu shot. Thank you. And
Hey.
that's my 10-year-old Basil at the Rosie the Riveter Museum.
Okay, Dr. Willis, thank you so much. That was really informative, really interesting, and I especially like the recommendations for the holiday gatherings. So looks like we have a bunch of questions here, and I'm just going to read them off to you, and we'll get through as many as we can. I know you have limited time, so
Okay.
let's just do it. Okay. Okay. Our first one. Okay, we have checked local testing facilities and they're all booked past Thanksgiving. Any suggestions how we can get tested before we are with our adult children?
Yeah. So the first was to reach out to the to your medical provider. You know, Kaiser has about half the covered lives, and Marin is providing testing to all their as a drive-through to their patients, and most medical providers are. Some people forget that step and just start looking online for options.
Mhm.
The LHI site, so I would encourage that person to look at, to go online to our website, coronavirus.marinhhs.org, and navigate to the, it's probably community testing, I think is the category. And there's a site, the LHI site, it's in the canal, and that's a public health site that we just doubled the capacity. So we have now 350 tests per day available for the public at that site. It really is reserved for people who can't otherwise get testing through their medical provider. So I don't want to just flood that site with people who are seeing it as a matter of convenience, because that would happen otherwise. And there are people that don't have insurance that need that access, but there is a resource there. So, and I know they have openings. So go there.
Okay, great. So the next question is, given the fact that we have slipped back into the red risk category, why are we allowing schools to open? And why does the Marin Health Department not dictate that schools have a consistent plan with regards to reopening? Why is Tiburon closing their schools for the weeks between Thanksgiving and Christmas, and Mill Valley schools are set to open on November 30th, immediately following the Thanksgiving break?
Yeah, so I guess the first part of that question is, why are we not closing schools in red, or if things are getting worse? And the answer is, well, first of all, it's, public health, the school decisions of opening and closing and timing are really up to the school. So we serve on the side as a guide and offer recommendations, but the decision making is really up to the school. The only decision that public health can really mandate is the decision to close a school that would otherwise want to be open. We could do that. We could say, from a public health standpoint, we are ordering that the school be closed. But we also recognize that we have the expertise and the knowledge to guide those decisions. And so we've been working very closely with Marin County Office of Education and all the school districts, weekly meetings with them. We started opening schools in purple, when our incidence rates was much higher, through a waiver process. And the fact that we have been able to successfully open schools, I think more than almost any other county, and yet now have case rates that are some of the lowest in the state, and that we've only had 15 cases total among students, one among staff, with zero transmission within the school setting, I think is a mark that we can do this successfully if we have practices in place at the school that are protective, and that the community around that school, the parents, administrators, and the wider community really understand the measures to take to allow children to enter the classroom safely works. And that's that would be the way that we're going to continue to approach this, allowing the schools to make the decisions themselves, offering guidance and counseling, and recognizing that because we opened again in purple successfully, and then moved through red and moved into orange without closing schools, that it won't be until purple again that we would, I think, have to worry about not opening schools that aren't open now.
Okay. Next question. When will we be able to get tested with quick results without having to have COVID symptoms or be referred by a doctor or have been around a known COVID positive person?
Yeah, I mean, it's a good question. And I guess we still see about a third of the people who are getting tested in our testing sites are looking for reassurance. They don't fit into those categories of people. So the testing resources are available for those. And that LHI site I mentioned is available for anyone who is seeking testing. And I would just suggest that if you're really just seeking testing for peace of mind and don't have any sense that there's been an exposure or that you have a particular reason to get tested. I mean, obviously symptoms, essential workers, and a known exposure are the three most important categories. Whatever that fourth category would be for someone who's looking for it for another reason needs to think twice about what it can tell you and what it can't. It will give you a sense of the snapshot of that particular moment. There might be a week interval, a week where if you've been infected, you're positive.
Mhm.
So if you're really looking for it for peace of mind, you have to think about the fact that you really need to get tested every week just to know. It's not going to tell you whether or not you've been infected in the past. That would be an antibody test, and that's a different question. So that PCR test is really only giving you a very narrow time window of your potential infection. And there's enough people who need it on a regular basis based on their work or based on having been exposed or symptoms that we really want to protect those resources for those settings. And you want it available to you when you're having symptoms or for those settings. But having said that, there is testing available for asymptomatic people at the sites that I already mentioned, and you can find it on the website.
Okay. Dr. Willis, how should local purveyors of PPE products like myself, this person is asking, best get ourselves in front of the companies that need us? Is there a county directory?
How do we, can you reframe that? Just what was that question again?
Okay.
How do we get PPE?
Yeah, how should local purveyors of PPE products get like myself, it says, get ourselves in front of the companies that need us? Is there a county directory?
I see. You mean, so this is someone who has PPE they want to sell.
I guess so. I don't know.
Okay. Yeah. I mean, I would just, I think reaching out to if I'm understanding, if the PPE purveyor is a provider of PPE, then reaching out directly to the hospitals is one, or you can reach out to our MOAC. I'll give you an email address real quick, MHOAC, MOAC @marincounty.org is our distributor of PPE.
Okay, thank you. Okay, now this is a good one. The primary way that the Outdoor Art Club raises money is by renting out the clubhouse and the grounds for weddings and receptions. And these are for groups of 50 to 100 people. When do you think larger group events like wedding receptions will be permitted in Marin?
Wow, I hope soon, but I am not. I mean, I don't think it's going to be anytime soon, unfortunately. And that's especially what we're seeing now. I would say summertime, is the earliest we would consider. We've just had to make a decision with the cultural services because as part of government, I help advise the Veterans Auditorium, et cetera. And we've really decided that all bets are, until summertime, there's basically nothing in person at any large scale should be scheduled.
Yeah, okay. And as vaccines become available in January, how long will it be before the general public will have access? And how will vaccine impact our club, the OAC's ability to start event rentals?
That's a great question. Yeah, so we're looking at there's going to be a sequence, right? There's going to be the essential workers, first tier, and then there's going to be people in the community who are at higher risk for bad outcomes if they do become infected. So our elders and people with chronic diseases, and then finally the general population. That's probably going to be, April, something like that would be an optimistic assessment. Once if these vaccines are in fact 90 to 95% effective, and we have widespread uptake, so there's going to be a whole educational need to make sure that people actually choose to get vaccinated. Yeah. And the vaccine has a PR problem right off the bat, but we're going to work through that. Then I think it's going to actually allow us to accelerate our reopening. So if to be optimistic, we might gain a couple months with vaccination. So if I would say April, May, June. May, June might be a safer time to start thinking about reopening those if we're able to get vaccine penetrance in the community.
Okay. So here's a question. It says, we know 2 different families in our pod, friends of these people, who are going to Hawaii for the holidays. I know they require testing to go to Hawaii, but is there testing required to return to California?
No, not yet, not yet. And Hawaii, Hawaii is a low prevalent. I mean, travel is not safe now. I wouldn't, but we don't have an official ban on it, But and Hawaii happens to be low incidence right now. It's an island, so they can do that, and they're doing a good job. And there's not a need for testing when you get back.
Okay. Let's see. What is and I'm just reading through these, but what is the likelihood that events like the Dipsy race and the bicycle events that are scheduled for next spring and summer, what is the likelihood that they'll be able to be held?
Yeah, I mean, I would say that there's a high likelihood that they're not going to be able to be held in the way they conventionally have been held. I'm one of the coaches on the Drake, or formerly known as Drake High School mountain bike team. We're thinking about, I mean, the spring is it's unknown. I would say it's unknown. We're thinking about time trial, competitions that are based on smaller groups of individuals as time trials. So I would say a modified version of those where you're able to guarantee more social distancing. Once people are out on the course and you're further apart, the risk is really low. It's where they're gathered at the start, at the finish, and just the mobility around that. So there's ways to be creative, I think, to try and allow people to still have that experience without the social gathering. But I could almost guarantee that it's not going to be just as it has been, at least this year.
Okay. I don't know what your time frame is, but why don't we take a few more questions? Is that okay?
Yeah, I've got to jump off in about 2 minutes. But.
Okay, so let's see. What would it take to close down the schools that are open?
What would it take to close down the schools that are open? So we have closure, policies around the closures. It's going to be school-based events. So if you have closures, at a certain point, it would get more disruptive to keep a school open than to close it. I mean, more disruptive to try and keep a school open, because if you have multiple cohort closures over time, each time there's a case in a cohort, we have to close that cohort for 14 days. And if you have a lot of prevalence, you're going to be closing over and over again. Yeah. And that's where you would have to close the school. So there's an algorithm, 5% or 5 cohorts close over a certain period of time. So it's going to be school-based, not community prevalence-based.
Okay. And this will be our last question then today. If a person comes to the ER or the ICU with a heart attack and also COVID-19, and then they die, will the cause of death always be COVID, or how do you decide?
Yeah.
How is that decided?
Great question. Yes, I think right now we are still, if someone dies of COVID-19 and is infected with COVID-19, it tends to be coded as a COVID-19 related death because we don't know all the different things that COVID-19 does. So that in that case, for example, we know that COVID-19 has cardiovascular effects. So we would not want to make the mistake of assuming that was not contributory to that heart attack, because it may have been. And so we are doing our best to try and capture primary and secondary contributions of COVID-19 to mortality.
Well, Dr. Willis, on behalf of the Outdoor Art Club and everyone who's Zoomed with us today, I just want to say thank you. I can't even imagine how busy you've been and are, and we're just very grateful for the time that you've given us today and updating us on the status of the virus. So, sorry we couldn't get to all the questions, and I just want to say good luck going forward, and know that as a community, we're behind you, we value and appreciate all your hard work. So thank you.
Thank you so much. And I'm happy to check in again. And the COVID-19, do you have the website where you can submit questions that were not answered to our team? We have a team of people who know more than I do about some of these things. They can answer those questions. Thank you very much.
Great. Bye. Thank you, Dr. Willis. Okay. We just have one final announcement here today, and that is the Outdoor Art Club's next speaker event will be on December 3rd at 1 o'clock. The speaker is Elaine Petrocelli. She's the co-founder of Book Passage, and Elaine will highlight new literature and suggest books for holiday gift giving. You can register for this popular event and all future webinars at the Outdoor Art Club's website under public events. You can also sign up to be included in the OAC's email list if you would like to stay abreast of the club's many public activities. So thank you for joining us today, and we look forward to seeing you again very soon. Thank you.